Alright, here's my audience for my informative speech.
Yep.
Alrighty. So, have you ever gotten your bell rung or had a fuzzy memory after getting hit in the head? Well, you may have had a concussion. You can get a concussion in many different ways. You can get hit in the head simply by falling off a bike, or getting hit in a sport such as football or rugby, or even from a car accident. There are many risks to having a concussion. For short term, you can have short memory loss, drowsiness, and you can even have mood changes. There are also many long-term effects of getting concussion. You can have permanent memory loss, suffer from early onset Alzheimer's, and second impact syndrome, which is when you get hit a second time before you're fully healed, which can leave permanent damage to your brain. How would you recognize if you had a concussion, or if somebody else had a concussion? There are many severities to a concussion, and they're graded at 3 different levels. Grade 1 concussion is the least severe. You have no loss of consciousness, but you may have short memory loss. Grade 2, you will have a loss of consciousness for a few minutes, but not exceeding 5, and you may have some amnesia for 30 minutes or less. Grade 3, which is the most severe, you will lose consciousness for over 5 minutes, and you will also suffer from amnesia from 24 hours or longer. You ask, what are the symptoms that you may be looking for if somebody has a concussion? They may suffer from headaches, they have sensitivity to light, they have blurred vision, or difficulty balancing, and these are just some of the physical symptoms. Some emotional symptoms is they may suffer from confusion, they'll have a hard time paying attention, such as in class or in your workplace. And you might have some post-traumatic amnesia where you might forget the events that led to your concussion or some of the recent things that have happened throughout the day. You may be asking, what can you do to help somebody with a concussion, or if you yourself has a concussion? If you are an athlete, you are recommended to stop play immediately, go to your trainer or a doctor as soon as possible, and have an exam to get checked up. There are many different tests that you can take to see if you have a concussion. One thing to help treat for concussions is to know the symptoms that I stated earlier. Knowing the symptoms can help you see somebody that has a concussion and help them out and get them the treatment they need so they will not suffer any more injury to themselves and risk the long-term effects. Never go back to any activity until you're fully healed from a concussion. There are many long-term risks from getting a concussion that can affect you long into your life. And that is my presentation on concussions.